If you suffer from varicose veins, it is important to first see a phlebologist who has the skills to undertake a full clinical and duplex ultrasound assessment and discuss the full range of options with you. At the initial consultation, the doctor will discuss your medical history and perform a clinical and ultrasound examination of your legs. The ultrasound scan forms an integral part of your assessment and helps the doctor determine the full extent of the varicose veins and the most appropriate treatment plan moving forward. There are several minimally invasive treatments that may be offered, often in combination, to help address your varicose veins effectively. These include endovenous laser ablation, radiofrequency ablation, ultrasound-guided sclerotherapy, direct vision sclerotherapy, otherwise known as surface sclerotherapy, medical-grade superglue, and ambulatory phlebectomy. Endovenous laser ablation was introduced in 1999 as an alternative to varicose vein stripping and utilises laser energy to seal larger, hidden varicose veins. A fibre optic laser fibre is inserted into the vein and the leg is numbed. When the laser fibre is activated, it is gradually withdrawn, heating and sealing the vein and allowing blood to be rerouted through other healthy veins. It is performed in an accredited vein facility as a walk-in, walk-out procedure and under local anaesthetic. Patients usually don't require any time off work and can resume normal activities immediately following the procedure. Some discomfort is expected and can be managed with a Class 2 compression stocking and mild analgesics. Radiofrequency ablation utilises microwave energy delivered through a specialised catheter with a heating coil at its tip. After administration of local anaesthetic, the radiofrequency catheter is inserted into the vein and the heating coil is activated, sealing off the vein. It is very similar to laser treatment, but since the delivery of microwave energy is capped, patients will often experience a slightly better recovery with less bruising and less discomfort. Ultrasound-guided sclerotherapy is an extremely useful procedure for varicose veins and can be used as a standalone treatment or in conjunction with laser, radiofrequency or glue treatment. Detergent foam is prepared using a carbon dioxide and oxygen mixture and directly injected into the varicose vein with precise ultrasound visualization. The foam solution displaces the blood within the vein, allowing it to directly damage and seal the vein off. This form of sclerotherapy requires expert ultrasound skills to accurately identify the abnormal varicose veins for direct injection. Following the procedure, you will be required to wear a compression stocking and walk half an hour a day for up to 2 weeks. Surface or direct vision sclerotherapy is the most common procedure for varicose veins worldwide. Utilizing a very fine needle, liquid sclerosant is injected into the surface veins and capillaries, causing them to collapse and shut down. Blood is then redirected through normal veins. Over a period of 3 to 6 months, the treated veins will gradually fade away. Medical-grade superglue is the latest method for treating varicose veins and is extremely effective and versatile. It is delivered into the varicose vein through a catheter or with a needle syringe approach and instantly seals the vein shut. Blood is immediately diverted into normal healthy veins. Local anaesthetic is not required for vein glue treatment and patients can return to normal activities immediately following the procedure. Ambulatory phlebectomy is the surgical removal of visible varicose veins through tiny needle hole incisions, as tiny as 2 millimeters in diameter. The varicose vein is then removed in small segments. Prior to removal, the veins are marked using a duplex ultrasound, local anaesthetic is applied, and the vein is then removed. Ambulatory phlebectomy is performed on an outpatient basis and can be performed in under an hour depending on the location and amount of varicose veins. Recovery is immediate, with patients usually returning to work the following day. Patients should be fully informed of all the options available to them for the management of their varicose veins. It's important to remember that treating varicose veins is not a one-size-fits-all, but instead requires the correct combination of procedures to achieve the best possible outcome. A thorough diagnosis is crucial before embarking on any of the treatments, and this should be carried out by a doctor who is trained to treat all types of varicose veins from start to finish.